Hi, I'm Dr. Sunitha. I am a rheumatologist at Continental Hospitals. Today I'm here to talk about lupus and pregnancy. Lupus is an autoimmune disease which commonly affects the young women in the reproductive ages. So there is a frequent question among the lupus patients, that is, I have lupus, whether I can have a normal pregnancy or I have a normal baby. The straight answer to this question is yes, lupus patients can have a normal pregnancy. So before that, one important thing that I want to tell you is lupus does not affect fertility. That means lupus patients can become pregnant unlike those who do not have the disease. However, it can affect the outcome or the success of the pregnancy. To have a successful pregnancy, one needs a perfect planning. So, when should a lupus woman plan a pregnancy? You should plan a pregnancy when your disease is in remission or quiet for a period of at least 6 months. So, the next question would be, when would I know that my disease is in remission? So, it is your rheumatologist who confirms that your disease is in remission. So, to call somebody with lupus as in remission, they should not have any clinical features suggestive of lupus. That means they are not supposed to have any symptoms of lupus. That means somebody should not have any joint pains, rashes, fever, or ulcers in the mouth, or excess hair loss. Along with this, the rheumatologist would be doing some blood tests for you to look for the blood counts and for the kidney involvement, like the urine test to see for the loss of protein, and they'll also be doing some other blood tests like double stranded DNA and complements to know the disease activity. With these tests, the rheumatologist would be confirming about your disease activity and would suggest you to further plan a pregnancy. Along with this test, there are 2 antibody tests which we would be doing when a lupus patient is going to plan for a pregnancy. The first one would be the APLA antibodies or antiphospholipid antibodies. When somebody is having these antibodies, they have a tendency for clot formation in the body automatically. So when somebody is having these antibodies, they may form clots anywhere in the body and also in the blood vessels which connect mother to the baby, that is placenta. So when the blood clots are forming in the placenta, there will be poor nutrition to the baby, which may result in miscarriages or intrauterine deaths in later part of the pregnancy. The second antibodies are anti-SSA or Rho antibodies. When someone is having these antibodies, they may rarely go into the baby and affect the baby. The manifestations mainly would be in the form of rashes to the baby, rashes over the body, or baby can have mild decrease in the blood counts or mild increase in the liver enzymes. However, these symptoms will only last for 4 to 6 weeks and usually improves with symptomatic treatment. The other most important thing before planning to pregnancy is the change of medication. Some of the medication that the lupus patients use, like mycophenolate mofetil, methotrexate, leflunomide, etc., are not supposed to be taken while they are planning for pregnancy. So when you consult a rheumatologist before planning, these medications are stopped and changed to a pregnancy safe medication. Coming to the complications to the mother, as I've said earlier, when the pregnancy is planned, when the lupus is inactive, the chances of complications are very less. One important complications that lupus patients can have in pregnancy is a flare of lupus. That means whatever the lupus symptoms that you have in the earlier before pregnancy, those symptoms may reappear, or the new symptoms of lupus can manifest when you are pregnant. The second thing is something called pregnancy induced hypertension or preeclampsia. That means you may have increased blood pressure when you are pregnant. Some may even have seizures or blurring of vision. The complications to the baby include miscarriages, intrauterine deaths, rarely birth defects if someone is using the pregnancy unsafe medication, or low birth weight of the baby. The safe and effective contraceptive methods for women with lupus include intrauterine devices or IUDs and progestin implants. Estrogen containing birth control pills are also used, especially in patients who have a well controlled lupus and also those who do not have antiphospholipid antibodies. To have a healthy pregnancy in patients with lupus, one should plan the pregnancy when the disease is quite for a sufficient period and to adhere to the medication which are prescribed by the rheumatologist. Thank you.